Unit OK. Stay calm. Check responsiveness. Call for help. If patient is a child, press Child button. Remove pad package. Cut or tear clothing to expose patient's bare chest. Cut or tear clothing to expose patient's bare chest. Open pad package. Attach pads to patient's bare chest. Attach pads to patient's bare chest. Attach pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. No shock advised. Start CPR. Push to match the tone. Push harder. Push harder. Good compressions. Stop CPR. Stop CPR. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR. Push to match the tone. Unit OK. Automatic defibrillator. Stop CPR. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock will be delivered in 3, 2, 1. Shock delivered. Unit OK. Stay calm. Check responsiveness. Call for help. If patient is a child, press Child button. Child patient selected. Remove pad package. Completely remove the child's shirt, cutting or tearing if needed. Open pad package. Attach blue pad to child's back. Tear purple sensor away from green pad. Place purple sensor on green pad. Attach green pad to center of child's chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. No shock advised. Start CPR. Push to match the tone. Continue CPR.